You felt it this morning, a scratchy throat or a dull headache. You reached into your medicine cabinet, grabbed a pill, swallowed it, and moved on. 50,000 years ago, that same minor ailment was a high-stakes gamble. Without a tribe to intervene, a small infection or an incapacitating fever could quickly become lethal. Our standard assumption is that ancient humans simply suffered in the dark, lacking the laboratories we use to validate what works. But we didn't invent medicine, we inherited it. Modern healthcare is built on a foundation of behavioral trial and error that our ancestors refined over hundreds of millennia. Aspirin is often cited as a milestone of early synthetic chemistry, first formalized by Bayer in 1897. Yet Egyptian medical papyri from 3,500 years ago already documented the use of the same active compound, salicin. If we go back 50,000 years, we find Neanderthals in Spain were chewing willow bark to extract that exact chemical. The pill in your cabinet is just a stable version of a molecule your ancestors pulled off a tree. For physical proof of early medical kits, we look to Otzi the Iceman, who died in the Alps 5,300 years ago. Among his gear were 2 pieces of birch polypore mushroom, carefully strung on a leather cord. We now know this mushroom contains antibiotic and anti-inflammatory properties. Otzi also happened to have intestinal parasites, the specific condition this mushroom is known to treat. This was pharmacology in action thousands of years before the scientific method. It was a system governed by observation and the accumulated memory of what kept people alive. When botanical remedies weren't enough, ancient humans turned to physical interventions. This is trepanation. It's the oldest known surgical procedure, appearing in the archaeological record over 7,000 years ago. Practitioners attempted to treat seizures or severe headaches, identifying the head as the source of the problem and intervening to relieve pressure. The survival rates are staggering. Bone regrowth around these cuts suggest 50 to 90% of patients survived. This was not random butchery. It was a practiced, multi-generational technique passed down through those who survived it. The hard drive for this medical knowledge was the shaman, a specialist who sat at the intersection of practical healing and the community's oral traditions. In a 12,000-year-old Natufian burial site, one woman was found buried with tortoise shells and leopard remains. Researchers concluded she was a healer, the most carefully buried person at the site. But an oral system has a single point of failure. If the shaman died before passing on their knowledge, the tribe lost its entire medical library in a single day. Some medical knowledge, however, was so vital it was coded into behavior rather than just story. Modern medicine spent decades trying to suppress fevers with ice baths, but many hunter-gatherer groups did the exact opposite. They intentionally moved the sick patient closer to the fire. They didn't have a theory for pathogens, but they observed that letting the body's temperature rise led to better outcomes. It was an intuitive alignment with the mechanics of the immune system that we only validated recently. In northern Iraq, Shanandar Cave offers a look at a different kind of medical technology. Researchers here found the remains of a Neanderthal man who lived to be around 50 years old, exceptionally old for his time. But his skeleton told a story of extreme trauma. His right arm had been amputated, he was partially blind, and he suffered from severe arthritis throughout his joints. He could not have hunted or gathered his own food. He survived only because his tribe chose to feed, protect, and care for him for years. This communal care is the oldest evidence of healthcare we have. It predates hospitals and universities by tens of thousands of years. We didn't invent the concept of medicine in a lab. We simply inherited a 50,000-year-old legacy of survival, memory, and the refusal to let one another die in the dark.